You test positive for coronavirus, the 2-week quarantine could turn into weeks in the hospital. And now local health leaders are worried the virus could have even longer lasting effects.
I've been a part of some very troubling calls with colleagues across the country who are concerned about the long-term impacts of the virus on patients beyond just the respiratory impact. This is not influenza where you get it and you recover. Many of my colleagues are seeing patients leave their care or the hospital but still report serious respiratory, cardiovascular, and neurological issues.
Earlier today, 41 Actions reporter Ariel Rothfield talked with a local couple still feeling the aftermath of this virus.
Starting about the 12th, I started having chills and fever.
From their home, Vicki Young and John Williams recounted their worst weeks.
I was having difficulty breathing.
The couple had just gotten back from a ski trip and both tested positive for the coronavirus. John ended up in the emergency room, then the ICU for more than 30 days.
The first couple times they told me he might not make it through the night. He probably would not make it through the night. We just held on to little bits of hope.
Which worked. After 45 days of fighting for his health, John got the announcement he was going home.
The hallway was full of doctors and nurses and staff, and it was just overwhelming to me, very emotional. I started crying.
Since then, he's been able to celebrate other things, like spending Father's Day with his kids. But every day, he still feels the aftermath of the virus.
I am unsure of myself on my feet. I am still weak in my upper body as well as my lower body.
Dr. Colleen Buinger is a hospitalist at North Kansas City. While some patients have reported irregular heartbeats, worsening kidneys, or less intense issues like spells of exhaustion, she says it's still hard to say exactly what the long-term effects of the virus are.
It's always concerning when there's something new and different that there may be things that we didn't think about that come up as a consequence later on in people's lives, particularly, a few years down the road. Will they start having trouble with their lungs? Will they develop pulmonary fibrosis or something as a result?
It concerns John and Vicki too. Their message, wear a mask and take the virus seriously.
We don't want to go back to where we were. It was not a pleasant position to be in.
Reporting in Kansas City, Ariel Rothfield, 41 Action News.